A hernia occurs when an internal organ or tissue bulges through a weak spot in the surrounding muscle or connective tissue wall. Imagine a tear in your shirt. A hernia is similar, where a weak spot in your abdominal wall allows a portion of your intestine or other tissue to protrude. This bulge can often be felt as a lump or swelling under the skin. Hernias are more common than you might think, affecting millions of people worldwide. They can occur at any age, but are more prevalent in older adults. While some hernias may cause no symptoms at all, others can be quite painful and require medical attention. Understanding the causes, symptoms, and treatment options for hernias is essential for everyone. This knowledge empowers individuals to recognize potential issues and seek timely medical advice, ensuring optimal health outcomes. Hernias often develop gradually, with the underlying cause being a combination of muscle weakness and strain. Some individuals may be predisposed to weak spots in their abdominal wall, making them more susceptible to developing hernias. Common factors that can contribute to hernia development include age. As we age, our muscles naturally weaken, increasing the likelihood of hernias. Heavy lifting, straining. During lifting, heavy objects can put excessive pressure on the abdominal wall. Chronic coughing. Persistent coughing, often associated with smoking or respiratory conditions, can strain the abdominal muscles. Constipation. Straining during bowel movements can weaken the abdominal wall over time. Other factors that can increase the risk of hernias include obesity, pregnancy, and previous abdominal surgeries. By understanding these risk factors, individuals can take steps to minimize their chances of developing hernias, such as maintaining a healthy weight, practicing proper lifting techniques, and seeking treatment for chronic cough or constipation. Hernias are typically classified based on their location in the body. The most common types of hernias include inguinal hernias. These are the most prevalent type, occurring in the groin area where the thigh meets the abdomen. Men are more susceptible to inguinal hernias due to a natural weakness in this area related to the descent of the testicles during fetal development. Femoral hernias. Also located in the groin, femoral hernias are more common in women, particularly those who are pregnant or obese. They occur slightly lower than inguinal hernias. Umbilical hernias. These hernias appear around the belly button and are often seen in infants and young children. They can also occur in adults, particularly women who have had multiple pregnancies or individuals with obesity. Hiatal hernias. Unlike other hernias that protrude through the abdominal wall, hiatal hernias occur when a portion of the stomach pushes up through the diaphragm into the chest cavity. Each type of hernia presents with its own set of symptoms and potential complications. Accurate diagnosis of the hernia type is crucial for determining the most effective treatment approach. Section 4. Recognizing the symptoms. While some hernias may be asymptomatic, others can cause a range of symptoms, from mild discomfort to severe pain. Common signs and symptoms of a hernia include a bulge or swelling. This is often the most noticeable symptom, appearing as a visible lump or protrusion under the skin. Pain or discomfort. The hernia may feel tender to the touch and cause pain, especially when bending over, lifting, or coughing. A heavy or dragging sensation. Some individuals describe a feeling of fullness or heaviness in the affected area. Nausea or vomiting. Hernias that obstruct the intestines can lead to nausea, vomiting, and constipation. It's important to note that hernia symptoms can vary greatly from person to person. Some individuals may experience intermittent symptoms, while others may have persistent pain or discomfort. If you notice any unusual lumps, bumps, or pain in your abdomen or groin, it's essential to consult a healthcare professional for a proper diagnosis. Section 5. Diagnosing a hernia. Diagnosing a hernia typically involves a physical examination by a healthcare provider. The doctor will visually inspect the affected area, feeling for any bulges or protrusions. They may ask you to cough or strain to see if the hernia becomes more prominent. In some cases, imaging tests may be ordered to confirm the diagnosis or rule out other conditions. These tests may include ultrasound, uses sound waves to create images of the internal organs and tissues, helping to visualize the hernia. CT scan provides detailed cross-sectional images of the body, allowing for a more comprehensive view of the hernia and surrounding structures. MRI uses magnetic fields and radio waves to create detailed images of the body, offering excellent soft tissue contrast for visualizing the hernia. Once the diagnosis of a hernia is confirmed, the doctor will discuss the available treatment options, considering factors such as the type, size, and location of the hernia, as well as the patient's overall health and preferences. Section 6. Treatment options. From watchful waiting to surgery. The treatment for a hernia depends on several factors, including the size and severity of the hernia, the symptoms it's causing, and the overall health of the individual. In some cases, watchful waiting may be recommended, especially for small asymptomatic hernias. Watchful waiting. This involves monitoring the hernia for any changes in size or symptoms. Lifestyle modifications, such as avoiding heavy lifting and maintaining a healthy weight, may be advised. Hernia truss. A hernia truss is a supportive garment that applies pressure to the hernia, helping to keep it from protruding. While trusses can provide temporary relief, they don't cure the hernia and may not be suitable for everyone. Surgery. Surgery is the most effective treatment for hernias, offering a permanent solution. The procedure involves pushing the protruding tissue back into place and repairing the weak spot in the abdominal wall, often using a surgical mesh to strengthen the area. Minimally invasive surgical techniques, such as laparoscopy, are often preferred as they involve smaller incisions, leading to less pain, faster recovery times, and reduced scarring. Your doctor will discuss the risks and benefits of each treatment option, helping you make an informed decision. Section 7. When to seek immediate medical attention. While most hernias are not life-threatening, some can lead to serious complications if left untreated. It's crucial to seek immediate medical attention if you experience any of the following. Sudden, severe pain in the hernia area. This could indicate a strangulated hernia, where the blood supply to the protruding tissue is cut off. Nausea, vomiting, and inability to pass gas or have a bowel movement. These symptoms may suggest an obstruction in the intestines. Fever, redness, or swelling around the hernia. These signs could indicate an infection. Remember, early detection and treatment are essential for preventing complications and ensuring the best possible outcomes for hernia management.